Once upon a time, in the faraway land of Ada, Albert woke up in excitement to go on a camping trip with two of his friends. He was planning a fun adventure in the local woods on campus, but little did he know he'd be meeting a new friend that day, Borrelia burgdorferi, the bacterium that causes Lyme disease. Although tick bites are easily avoided, Albert's childlike characteristics made him very vulnerable for tick bites. While his friends prepared, Albert had much more fun playing with his rubber ball.
Borrelia burgdorferi is a gram-negative spirochete bacterium. It has a unique genome that may allow it to survive in ticks as well as mammalian hosts. The typical reservoirs for this pathogen are white-footed mice and deer, but other small mammals such as squirrels are known reservoirs as well. Lyme disease is vector-borne, and the pathogen is carried by Ixodes scapularii, more commonly known as deer ticks, or black-legged ticks. Following detachment from the original reservoir, or the deer, the pathogen is carried by the tick. The tick then moves along until it is introduced into the new host organism.
Borrelia burgdorferi enters when a human host is bitten by an infected tick. Lyme disease can only be contracted if the tick feeds for a minimum of 1 day. The pathogen attaches to carbohydrates and proteins on the surface of host cell membranes, specifically fibronectin receptors. Over time, Borrelia burgdorferi avoids attack from the human immune system by resembling human cells. It can therefore produce a delayed and negative immune response. The pathogen also hides from the immune system in the cerebral spinal fluid and synovial joints, where the body's defenses cannot go. Flu-like symptoms manifest 7 to 14 days after infection. The body produces an inflammatory immune response to the infection. The pathogen triggers mechanisms that cause the release of interleukin-1 and tumor necrosis factor, which cause degeneration of joints and cell apoptosis respectively. Interleukin-1 and tumor necrosis factor also stimulate endotoxic shock symptoms. Lyme disease is not communicable and does not exit the human body.
Worried because their friend had not arrived to class for 3 days, Briar and Claire went to see if Albert was all right. Worried he might have the swine flu, his friends call for the doctor. The doctor explains.
The incubation period for Lyme disease is 7 to 14 days. Beginning symptoms include a red rash, fever, headache, myalgia, lymphadenopathy, and fatigue. This disease's unique symptom is a red rash at the site of the tick bite known as erythema migrans. It starts as a red spot on the skin and expands over the next few weeks to a circular, target-shaped rash reaching several inches in diameter. Erythema migrans can also form at different locations on the body. If left untreated, the infected individual may begin to show signs of arthritis from joint inflammation and neurologic damage resulting in seizures, comas, or death. There's also a slight risk of developing heart problems, hepatitis, and severe fatigue. New symptoms can emerge anywhere from 1 week to 2 years after initial infection. The only symptom unique to this disease, erythema migrans, is only apparent in 3/4 of the infected people. Lyme disease is often misdiagnosed as influenza, arthritis, or multiple sclerosis. In order to provide diagnostic support, a blood serologic test can be conducted called the enzyme-linked immunosorbent assay, which detects IgM antibodies or IgG antibodies. Other tests that can be done include the Wampel-Preview Borrelia burgdorferi antibody detection assay to detect IgG and IgM in human serum or whole blood, and the Borrelia burgdorferi specific immune complex test to isolate ICs.
Patients who are diagnosed early with Lyme disease can be treated with antibiotics such as doxycycline or amoxicillin. Doxycycline works by blocking protein synthesis by 70S ribosomes, resulting in the death of the bacteria. Amoxicillin, like other beta-lactams, inhibits the cross-linking of peptidoglycans that make up the cell wall of gram-negative bacteria, resulting in osmotic lysis of the cell. Doxycycline can be used in adults and children over the age of 8. The adult dose is 100 milligrams by mouth 2 times a day for 10 to 21 days. The children's dose is 1 to 2 milligrams per kilogram 2 times a day for 10 to 21 days. Amoxicillin can be used as an alternative to treat pregnant or lactating women and children under the age of 8. The adult dose is 500 milligrams by mouth 3 times a day for 14 to 21 days, and the children's dose is 25 to 50 milligrams per kilogram per day, divided 3 times a day for 14 to 21 days. The main way to prevent Lyme disease is to avoid tick bites and tick-infested areas. If you cannot avoid tick-infested areas, protect yourself by wearing long pants that are tucked in and long-sleeve shirts that are also tucked in. Spray clothing with insect repellent that contains DEET. Wear light-colored clothing so ticks may be visible and perform tick checks. Remove any ticks from the skin by using tweezers. Grab the tick close to your skin and remove it straight upwards to remove all of the tick. Do not twist. Wash the bite with alcohol or soap and water. Prophylactic treatment may be given if the tick bite was determined to be from Edosis scapularis. This treatment is a 200 milligram single dose of doxycycline. You can also control the deer population and tick population. You can reduce the tick population in your yard by removing leaf litter and brush. The Lyme disease vaccine is no longer available, although it was approved by the FDA.
Why didn't I wear pants?
Although he was lucky this time, if Albert does not change his childish ways and be more prepared, he will likely suffer further diseases, or worse.
Nah, I'm just playing. Albert lives happily ever after. The end.